Hello, I have an order from Dr. B today to draw up a PPD injection for a patient, Bob. We have in room 115 for a TB test. The first thing I'm going to do, I'm going to go into the med room and I'm going to check the MAR, make sure I have the right provider. Dr. B did order it for Bob in room 115, so it's the right patient. Right dose is going to be 0.1 mils PPD for that TB test. The right route is going to be intradermal on his forearm. And then the right time, the time should be now that I should administer this injection, and today's date. And then I'll document that when after I come into the patient's room. So the first thing I'm going to do is I'm going to withdraw the medication that I need, the vial, and then I'm going to check that there are no particulates in here. The vial is not cracked or there's nothing wrong with it. The date is still accurate, so 4/2027, which still works, and I'm going to make sure that is accurate with the MAR. Make sure that that's all correct, and it is a multi-dose vial, so I'm going to go ahead and put my initials and the date on it because I am going to draw that up today, and it will be the first time it's used. The next thing I'm going to go ahead and do is roll the vial in between my hands to mix that up. Okay. Perfect. So I'm going to go ahead and pop the top off of this vial. And I'm going to take my alcohol pad, and I'm going to clean the top of the vial. And then that is going to go ahead and be my sterile surface. I'm going to take my needle out. And I'm going to go ahead and uncap my needle. Put that on my sterile surface. I'm going to uncap my needle. Okay, so the first thing I'm going to do is I'm going to go ahead and inject 0.1 mils of air into my vial, or into my syringe. I'm going to go ahead and place that into my vial. And I'm going to inject that air into the vial, and then stabilizing it, I'm going to withdraw 0.1 mils, and I'm going to go ahead and tap that, get those bubbles out. I'm going to swirl it. Perfect. Okay, so I have 0.1 mils drawn up. Go ahead and take that off. I'm going to recap my needle, and then remove that needle. I'm going to dispose of it in the sharps container. Okay, the next thing I'm going to do is I'm going to reapply a sterile needle. And then I'm going to go ahead and take my vial and my syringe, and we're going to head into the patient room.